Are enough Democrats and possibly some Republicans joining you to preserve the bill? I mean, it's obviously not going to pass the Senate, but will it pass the House?
I expect it will. I think the Republicans have the vote. That's their campaign promise. The effort we're going to make is to make this specific so that people understand that this is not about the rhetoric of Obamacare, which the Republicans did a great job vilifying. It's about practical benefits that are going to help the middle class. Let me give a couple of examples. You know, we have Donna Watts from Plainfield, Vermont. Her son got out of high school, got a job they thought was great, $10 an hour. But it didn't have health care, as most entry-level jobs don't. He got in a car crash, thousands of dollars of bills. That whole family is trying to figure out how to pay them. Under the health care bill, Donna's son would continue to have health care on her policy, and the repeal will take that away. Or let's say your husband or wife has cancer, pre-existing condition. Under the health care bill, they have a right to buy health insurance. Under the repeal, they lose that benefit. Your mom and dad are seniors, and they're taking care of themselves. They can get free preventive care under Medicare, under the Obama health care legislation. The repeal is going to take that away. So the question that we're going to ask is, are they willing to take away that health care from Donna Watts' son? Are they willing to take it away from our fathers and mothers who are going to get free preventive care? Are they going to deny coverage to folks that have cancer or another pre-existing condition? When you get specific, the American people support those specific provisions. This is about real-world consequences to real families. It's not about the campaign and the political rhetoric anymore.
Mark Meckler, what do you make of the president's attitude toward this incoming Republican House?
Well, I haven't been to Hawaii. I'd like to go sometime. But, you know, the Republican leadership, they won the election, and elections have consequences, and they have to make a decision whether they want to continue political battles or make progress. And, you know, Phil Rowe made a point about health care that I agree with. It costs too much. That's not a function of the Obama bill. That's the American medical system, where we are seeing the cost of health care increase 2-3 times the rate of inflation, the rate of profits, the rate of wage growth. That is unsustainable. And whether you're a single-payer advocate, as I am, or a private payer advocate that maybe Phil is, it costs too much and we can't afford it. But why would the first step that you take be to abolish some of the things that are actually working for American families? I mean, this Donna Watts in Plainfield, Vermont, her son gets an entry-level job, can't afford health care. Most kids starting out can't get a job with health care. Now that person can be on his mom's policy. He's left with these big bills, and the Republicans in repealing are going to take all the good away and start from scratch where everybody's on their own. That just doesn't make a lot of sense. So the real question here is, will the leadership propose real problems? The cost of health care is a legitimate problem. Republicans and Democrats have responsibility to address it, but create space where we can work together to make progress. Or will it just be a political dagger to the heart of the progress we've made for the middle class?
Congressman Rowe, you mentioned that what everyone agrees on, health care is too expensive, and yet in repealing the health care